Welcome to our educational video on understanding electrocardiograms, commonly known as ECGs or EKGs. In this video, we'll explore the differences between ECG and EKG, dive into ECG patterns, and uncover common ECG abnormalities that can reveal important information about heart health. First, let's clarify the terms ECG and EKG. ECG stands for electrocardiogram, a term widely used in English-speaking countries. On the other hand, EKG comes from the German term electrocardiogram, named after German cardiologist Wilhelm Einthoven, who pioneered this technique. Despite the different abbreviations, both ECG and EKG refer to the same diagnostic test used to monitor the heart's electrical activity. Now let's dive into ECG patterns. An ECG pattern provides a graphical representation of the heart's electrical impulses. Here are the main components. The P wave. This small upward deflection represents atrial depolarization, or the electrical impulse traveling through the atria. The QRS complex, the most prominent feature, indicating ventricular depolarization. It consists of three waves, Q, R, and S, showing the electrical impulse moving through the ventricles. The T wave. A smooth upward deflection that represents ventricular repolarization, or the recovery phase of the ventricles after contraction. The U wave. Less commonly seen, it may represent the repolarization of the Purkinje fibers and follows the T wave. The PR interval, the time from the onset of the P wave to the start of the QRS complex, reflecting the impulse travel from the atria to the ventricles. The QT interval, the time from the beginning of the QRS complex to the end of the T wave, showing the total duration of ventricular depolarization and repolarization. Let's now discuss some common ECG abnormalities. Arrhythmias. These are irregular heart rhythms. Examples include atrial fibrillation, characterized by an irregular rhythm and absence of distinct P waves. Ventricular tachycardia, a rapid heart rate with a wide QRS complex originating from the ventricles. Bradycardia, an abnormally slow heart rate, typically below 60 beats per minute. ST segment elevation or depression, ST elevation often associated with ST elevation myocardial infarction or STEMI, indicating acute myocardial injury. ST depression may suggest myocardial ischemia or angina. T-wave abnormalities, inverted T waves, can indicate myocardial ischemia or other cardiac conditions. Peaked T waves might be a sign of hyperkalemia or elevated potassium levels. QRS complex abnormalities, wide QRS complex, may indicate a bundle branch block or ventricular arrhythmias. Prolonged QRS duration associated with conduction abnormalities, PR interval abnormalities. Prolonged PR interval indicates first-degree heart block, where the impulse is delayed but still reaches the ventricles. Shortened PR interval may be associated with pre-excitation syndromes like Wolff-Parkinson-White syndrome. QT interval prolongation can increase the risk of ventricular arrhythmias and is associated with conditions like long QT syndrome. Understanding these patterns and abnormalities is crucial for diagnosing and managing heart conditions effectively. Accurate interpretation of ECGs helps healthcare professionals provide timely and appropriate care. Thank you for watching our video on ECGs. Stay informed and empowered about heart health and diagnostic tools. For more information on ECGs and heart health, visit our website